Hello, Lance Turner here with ArkansasBusiness.com. This week we sat down with John Vinson, who is the CEO of the Arkansas Pharmacists Association, and we talked to him about how pharmacies are positioned to take part in the state's strategy to distribute the COVID-19 vaccine, a strategy outlined by the governor earlier this week, with more information to come next week. John and I talked about how pharmacies are equipped to handle that rollout, what that rollout will look like, and what role that businesses may actually play in urging employees to get vaccinated, sharing that vaccination information with employees. We also talked about how the rollout is looking now, how it has been progressing in the early weeks, and how it's positioned to continue when phase 1B of the rollout begins in February.
We have pharmacies in 73 of the 75 that are receiving vaccine this week, and there are a total of 212 pharmacies. They're actually really the third wave of pharmacies getting vaccine. The first week, we had about 5 pharmacies. The second week, we had a total of 8. Started adding in the long-term care rollout that second week as well. That probably boosted that number up to about 30 pharmacies. But in those early phases, those pharmacies were 98% focused on long-term care and health systems workers in hospitals, in smaller to medium-sized hospitals. Those 8 that I talked about were strike teams, meaning they had ultra cold freezers, they had special training, they had special coolers where they could then transport the supply chain to smaller hospitals like Baptist over in West Memphis and Crittenden County, and hospitals in El Dorado and Camden, Lake Village, those kind of places. We've supplied those. In fact, many of those are starting to get their second doses. So there was pharmacies from all over, out of those 8 have been traveling across the state today, in fact, to then provide second doses to some of those smaller and medium-sized hospitals. Now, the big story this week is we got approval in the plan to order vaccines to go out to those 212 pharmacies. Of course, 212 is a number that's significant because that's the boiling point of water. And the thought process there was, let's stop this virus and let's turn up the heat on this virus to stop its spread. And we're going to get through our outpatient community health workers, starting at the top with physicians and other primary care clinicians, working our way down to all healthcare workers over the next few weeks. Governor did set a plan for approval of the next phases of 1B and 1C, with a goal to begin those phases on February 1st, including vaccinating our adults over age 70, our teachers, and other groups within the essential workforce. That will begin by February 1st. Our goal is to help the governor beat that expectation and to start vaccinating our residents of 1B and 1C. Well, not 1C, but 1B prior to February 1st. So we're working hard to make that happen.
So Group 1B starts February 1st officially, but you'd like to do it earlier if you can.
Absolutely.
It's a group of about 400,000 Arkansans, if I have this correct, and it's people in food and agriculture industry, manufacturing, grocery stores, public transit, childcare, legislators. Our legislators, I believe, are in that group as well. What are pharmacies going to have to do to get ready for that big influx of people, I guess, coming to their centers physically and getting those vaccinations?
I see pharmacists could provide services to any of those groups in 1B, but they're going to play a really key role in the patients over 70, because patients over 70 fill prescriptions, right?
Right.
Yeah, if you're blessed enough to live to above 70, the vast majority of our citizens over 70 fill at least one prescription a month. And so a lot of those will be easy for us to provide vaccinations to. A lot of our pharmacies have really great relationships with our schools. They might have already been in there to vaccinate their school nurses. They may be used to working with pharmacies to provide flu vaccines in the school district. So I expect them to play a big role with that population. There are lots of other areas in the essential workers we expect pharmacists to provide the vaccines, but when we get to the level of where there's 400,000 people, assuming we have enough vaccine coming in at that time, that we increase the supply chain as we get more orders each week. I expect that they'll begin to send vaccine not just to pharmacies, but to additional pharmacies above and beyond the 212 that I talked about. I expect that they'll send vaccine to, like, for example, Walmart. Walmart has 4 pharmacies in the 212 that I mentioned a minute ago.
Okay.
But in reality, they have over 120 pharmacies in the state. And Walmart alone has 30,000 employees that would be considered like grocery workers or essential workers that you just described. So we would hope to get vaccine to those additional locations so they could vaccinate their own employees. That's going to be coordinated with the Department of Health, Adam, AJ Gary, and then also Major General Penn of the National Guard to figure out all those logistics and what the details of that plan look like. But we'll play a big role in pharmacy, but we expect to be collaborating with our primary care physician clinics, local health units, our hospitals, and also additional community pharmacies.
Are there going to be any challenges that a smaller pharmacy might face versus a Walgreens or a CVS in trying to handle this project?
It's actually interesting. There are certainly advantages and disadvantages depending on your size. One of the advantages that the smaller pharmacies actually have, I'll answer this a little bit different way, but one of the advantages the smaller pharmacies have is they're nimble. They can react quickly. They can schedule things. They can, if something's not working, it's easy to adjust, as any small business has that authority. And it's really easy to get to the owner and the manager to make those decisions quickly. And that's a good skill to have in a pandemic. They're also easier in a smaller pharmacy, able to onboard volunteers, for example. There's very little red tape or legal hurdles for them to jump that you might have in a large corporation where things have to be vetted by legal and policy procedure and human resources. Our smaller businesses and smaller practices can onboard volunteer student pharmacists, nurses, physicians even that can come in. Advanced practice nurses I know have already begun to volunteer with some of these smaller pharmacies. So that's a real advantage.
You said on Tuesday that pharmacists are thrilled to be taking part in this project. Apart from helping the state and the country, is there a business upside to pharmacies taking part in this? I mean, is there any kind of is this good for business for pharmacies?
First and foremost, it feels good to be needed. It feels really good to have expertise in pharmaceuticals and have a pharmaceutical that, like this one, that's 100% effective, at least in the clinical trials, at preventing death. Really, the most important thing about how effective a pharmaceutical is if it prevents the hospitalization and death.
Right.
If the symptoms are similar to the common cold, well, it's unfortunate that you got it, but in reality, it didn't damage your quality of life or your ability to live life like you would like to live that life. So that's at the top of, when you take the oath of a pharmacist, this is an amazing opportunity to be a part of the solution. Now, from the business side, there is the ability to get paid for an administration fee through insurance, and even through the federal government. HR, Health and Human Services, has the ability for uninsured patients for the pharmacist to submit that billing to them to be paid an administration fee. So it's additional revenue that they might not have ordinarily been paying for. So it's a new business opportunity for new revenue. And then just from a pure business perspective, because the vaccine has been paid for by federal dollars, the vaccine, the syringe, the needle, you don't have a cash flow problem. All the product and supplies have been purchased and they come to your business, and then your investment in providing that service is the time for your employees, the logistics for actually vaccinating the patients that need it. So there is some cost, but you don't have that cash flow issue of large investment of product sitting on a shelf. It's already been purchased, and your goal is just to do the procedure, the actual injection. So there is an opportunity for some increased revenue, and that's good for these small pharmacies.
If a business falls in these early categories, of essential workers or essential people, the 1B, for example, even the 1C. How should businesses play a role in trying to get employees to pharmacies for vaccinations? Are there ways? Are there things being set up to sort of facilitate that?
One is education, communication, education to your employees. There is a significant amount of vaccine hesitancy in society, meaning they may not have either the correct information or they may have misinformation, and having factual education to make good decisions. Employers can help to get that information to their employees. There are some employers that are mandating the vaccine. I'm not a supporter of that because it's a brand new vaccine with an emergency use authorization. So I'm not encouraging that, but that is happening in some businesses, and particularly in those in certain healthcare environments like long-term care facilities. There's also many employees that are incentivizing through incentives, kind of like a carrot. If you get your vaccine, they're making it easy to be paid, where you're not having to take time off to go get vaccinated, where it's part of your duties as an employee. So that's really nice for businesses to do that, to remove any barriers that an employee would have to get vaccinated. If you have enough employees, there is good medical literature out there that the two things that absolutely help to achieve a higher vaccination success is a strong, solid recommendation from their provider, the person prescribing the vaccine, which it could be a physician, it could be a nurse practitioner, it could be a pharmacist, like our pharmacists are able to prescribe the vaccine under federal law. So that's one. And the second most important thing is to provide those vaccines at the workplace. So many employers are big enough where they have their own occupational health centers. Those employers could enroll with the Arkansas Department of Health and sign up their occupational health center to actually receive the vaccine. If they don't want to receive the vaccine and jump through those hoops and paperwork that are additional to this vaccine, they could still partner with a local pharmacy or local clinic who could come in, and they could work together to vaccinate their employees on site.
Well, John Vinson, the CEO of the Arkansas Pharmacists Association, thanks for your time today.